Okay, we are live. Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Harshini from Apollo Cradle and Children's Hospital. She is going to talk about breast cancer screening. So, stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Yeah. Good afternoon, everybody. I'm Dr. Harshni. I'm a consultant radiologist in Apollo Cradle Hospitals, Kondapur and Jubilee Hills, Hyderabad. So today I would be dealing with the topic of breast cancer screening. So when should the screening be done? What are the ideal tests for which age? I would be telling today. Coming to breast cancer, it is one of the most common cancer among Indian women with an incidence of 25.8% in 25.8 per 1 lakh women according to the Ministry of Health and Family Welfare. Late detection is responsible for poor quality of life and it's a leading cause of death. If detected early, breast cancer has a very good life in metropolitan regions, one in every 22 women have breast cancer over their lifetime. But in rural areas, only one in every 60 women develop breast cancer as per estimates. Screening finds the disease even before symptoms begin in a few of them. The goal of screening is to detect disease at its earliest and most treatable stage. Screening tests may include lab tests that check blood and other fluids, genetic tests that look for inherited genetic markers linked to the disease, and imaging exams that produce pictures of the inside of the body. So, breast screening recommendation from Breast Imaging Society of India says that take taking all of so people 40 years and above uh, are recommended to start taking breast screening or by mammography, and people who have completed their family also can go for mammography. Annual mammography is advised till the age of 70 years. Beyond the age of 70 years, it is advised that the decision is made on the lady's comorbidities and life expectancy. So screening has to be done for both the breasts, and mammography is the best method for screening. And screening or surveillance of contralateral breast for metachronous breast cancers after one breast is removed has to be also done for all the people who have already got a breast removed. Ultrasound and MRI may be required for younger women because mammography has radiation, so we don't recommend it to younger women and people who have not completed their family. The next These tests are typically available for all the general population. However, an individual's need for a specific screening tests are based on factors such as age, gender, and family history. In breast cancer screening, a woman has no signs of or symptoms of breast cancer, undergoes a breast examination. In that, there are two steps. One is clinical breast examination, and then comes the imaging, and then the lab part. In clinical breast examination, of um, a physical examination of the breast by a doctor or a health professional is done, and the symptoms are and the findings are noted down. Then a mammography is done. Mammography has two parts: mammography and ultrasound screening. When both are done together, only it gives a better result for us. So mammography is nothing but a low dose X-ray exam that produces image of a breast called as a mammogram. Mammography plays a central part in early detection of breast cancers because it can often show changes in the breast before a patient or a physician can feel them. Research has shown that annual mammograms can lead to early detection of breast cancers when they are most curable and breast conservation therapies are available. A mammogram may also find ductal carcinoma in situ, abnormal cells in the lining of a breast duct that may develop into an invasive cancer. Mammography is the only breast cancer screening tool known to reduce deaths from the disease. The other supplement, so we might get a doubt that mammography has radiation. So I have already told you mammography is preferred in patients above 40 years and people who have finished their families. So for people below that, or who have other things where they cannot go for a mammography, there are two more important tests, examinations available, that is MRI or a ultrasound screening. So, but mammography is the best. Neither MRI nor ultrasound is meant to replace mammography. Rather, they are used in conjugation with mammography in selected women. Women should consult with the referring doctor or radiologist to determine if MRI or ultrasound screening is appropriate for which one is appropriate for them. MRI of the breast may be used for women at high risk for breast cancer, typically because of a strong family history of the disease. Ultrasound of the breast may be used for women who are at high risk for breast cancer and unable to undergo an MRI examination, or women who are pregnant and should not be exposed to X rays like in mammography. Ultrasound of the breast can also be used to screen women who have dense breast tissues, meaning there's a lot of ducts, glands, fibrous tissue, and less fat, making it harder to find cancers with traditional mammography. So the dense breast has advantages with mammography and screening ultrasound also, because in dense breast mammography cannot pick up everything, so we have to undergo a screening ultrasound with it. So first, coming to clinical breast examination, what do we find when we do a clinical breast examination? Lumps or any other or anything unusual when we may find, and women may also perform a breast self examination by checking their own breast for lumps or changes in size, shape, and any changes in the skin and everything have to be observed at least 3 months once. You have to stand in front of the mirror and do your self breast examination. The clinical breast exam and breast self exam can help women become more familiar with regular look and feel of their breasts and more readily identify any changes if they detect over time. After the If the breast is normal, we can just directly go for a mammography screening. In a screening mammography, it is a type of X-ray, and this type of imaging involves exposing the breast to a small amount of radiation to obtain pictures of the inside of the breast. During mammography, a qualified technician will position your breast in the mammography unit, and it's placed on a special platform, and compression is applied with a paddle uh, so that the breast is well visualized on the X-ray film. Usually, two views of each breast is taken, and if any suspicious lesion is found, we may request for more views. And then the next step is breast tomosynthesis. It's called a three-dimensional mammography. It is an advanced type of breast imaging that uses low-dose X-rays and computer reconstruction to create images of the breast. It aids in the early detection and diagnosis of breast cancer before women experience any symptoms. Breast tomosynthesis is not yet available in all imaging facilities because of the costing and the machinery required and everything. Mammography is usually available even in the lower centers, and everywhere right now mammography is available. Breast ultrasound, then the other method is a breast ultrasound. It is a type of imaging that uses sound waves to create pictures of the inside of the breast. Ultrasound can capture images of areas of breast that may be difficult to see with mammography. Like, like as I told you before, any dense breast, people with dense breast, mammography cannot pick up small lesions. So for such people, it might be useful. It can also help to determine whether a breast lump is a solid mass or a fluid filled structure. On mammography, we might find it as a mass, but exactly is it completely solid or fluid? On ultrasound screening only, we can make out of that. So, breast ultrasound is done like a usual ultrasound. You lie on your back, and the breast is exposed, and gel is applied, and we image both the breasts. And whenever we are screening for breast cancer. We even screen axillary regions on both the sides. Then coming to breast MRI, during a breast MRI, a powerful magnetic field, radio frequency pulses, and a computer are used to produce detailed pictures of the inside of the breast. MRI is helpful in finding abnormalities that are not visible with mammography or ultrasound. In general, MRI is used only in women at high risk for breast cancer, and younger people or people without their family being completed. Uh, we use this MRI technique for them. For an MRI, you face down on a platform with opening to accommodate your breast and allow them to be imaged without compression. There is no compression used for an MRI breast. The technologist will insert an intravenous catheter. So MRI is done in two ways. One is a plain MRI, and one is a contrast-based MRI. If needed, contrast may be given. Then, after your breast is placed in the breast coil of the MRI machine, you will be moved into the magnet of the MRI unit, which is a large tunnel, and an initial set of images will be taken. And if we find any high suspicious lesion, then and there we can decide about giving contrast, or if it is not needed, we will not do it. Only a plain MRI is sufficient. Now we will read. Now I will be telling you about benefits of each of the imaging benefits, and what are the disadvantages. Coming to mammography, benefits is imaging the breast improves the physician's ability to detect small tumors. When cancers are small, the woman has more treatment options. The use of screening mammography increases the detection of small abnormal tissue growths confined to the milk duct in the breast, called as ductal carcinoma in situ. These early tumors rarely harm patients if they are removed at this stage, and mammography is the only proven method to reliably detect these tumors. It is also useful for detecting all types of breast cancer, including invasive ductal and invasive lobular cancers. Mammography has been shown to decrease the number of deaths from the breast cancer when it is used as a screening method. No radiation remains in a patient's body after an X ray examination. Risk: there is always a slight chance of cancer from excessive lifetime exposure to radiation, which is produced by a mammography. However, the amount of radiation from a mammography is very small, and the benefits of an accurate diagnosis outweighs the risk. And false positive mammograms may also occur. 5 to 15% of screening mammograms require more testing, such as additional mammograms or ultrasound. Most of these tests turn out to be normal. If there is an abnormal finding, a follow up or a biopsy may have to be performed. Most biopsies are done with a needle and confirm whether the what type of lesion it is. Is it a benign or a malignant lesion? Based on statistical studies on the incidence of cancer over time, some researchers have suggested that cancer screening identifies both life-threatening diseases and diseases that would never have caused symptoms during the patient's lifetime. A phenomena called as overdiagnosis. Overdiagnosis of breast cancer is likely very small. Scientists are working on methods to classify abnormal cells according to their potential to cause harm. Women should always then before going for a mammography technique, women should always inform their physician or x-ray technician if there is a possibility of them being pregnant. Breast ultrasound. Ultrasound is a non-invasive procedure, has no radiation, and it is widely available. easy to use, and less expensive than other imaging modalities. All these are the um, benefits. Ultrasound imaging is safe. Ultrasound scanning may give a clear picture of soft tissues, and it can differentiate between a solid and a fluid filled structure very clearly. Ultrasound scanning may give a clear picture of a soft tissue that do not show up well on an X-ray. Ultrasound imaging can help detect lesions in women with dense breasts that may not be visible on a mammogram. Risk: there are no harmful effects on the human. Interpretation of breast ultrasound may lead to additional procedures such as follow up or an aspiration or FNAC or a biopsy. Many of these areas to be of concern only on thought to be of concern on ultrasound turn out to be non-cancerous on invasive procedures. Breast MRI benefits. MRI is a non-invasive technique that does not involve exposure to radiation, and it has proven valuable in detecting breast cancers and finding cancers that are not even seen on mammography or ultrasound. Very tiny things are also picked up by MRI. The ability of MRI to detect breast cancer does not appear to be compromised by the breast density. So, very clear imaging of the breast is done. MRI, as an addition to mammography, has been shown to be useful in evaluating women with high risk for breast cancers. If a suspicious lesion is seen with MRI only, MRI can then other studies can be done with MRI. Risks. Many potential abnormalities seen on MRI are proven to be benign. MRI poses almost no risk to the average patient when appropriate safety guidelines are followed. Although the strong magnetic field is not harmful itself, uh, when you have any implants, MRI is not advised. Like a metal implant or a pacemaker, anything in your body, we don't advise MRI. There is a very slight risk of an allergic reaction when a contrast material is injected. Such reactions usually are mild, and within a few hours they settle down with medication. Nephrogenic systemic fibrosis is currently a recognized but rare complication of MRI, believed to be caused by the injection of high doses of the MRI contrast material in patients with poor kidney function. So, before going for a contrast MRI, we have to check for the kidney functioning, and depending on that, only we can go for a contrast MRI. Manufacturers of IV contrast indicate mothers should not breastfeed their baby for 24 to 48 hours after the contrast medium is given. So, next, there are some common questions. What happens if something is detected on my screening exam? Lumps, other abnormalities, or questionable findings in the breast are often detected by screening tests. However, it is always not possible to tell from these imaging tests whether a finding is benign or cancerous. We are only seeing what is visualized by the eye, but the exact content of it cannot be determined with all these imaging tests. So, to determine whether there is a cancer present, your doctor may recommend either a diagnostic mammography, or if only mammography was done, screening ultrasound along with it, then an invasive procedure like an FNAC or a biopsy if highly suspicious. If a finding is proven to be benign by appearance on an ultrasound or an MRI after a mammography, if these tests do not clearly show that then no need to take any action. But if these tests do not show clearly the finding is benign, a biopsy is necessary. In a biopsy, a small amount of tissue is removed. In a biopsy, a small amount of tissue is removed under local anesthesia so that it is sent for examination and checked whether it is benign or cancerous and what type of lesion it is. Then, how can all these procedures be done? If the lesion is very small, or very big and it is felt to the hand on examination, we just do an FNAC or biopsy blindly. When the lesion is deep seated or cannot be felt to the hand, we can do an ultrasound guided breast biopsy or an ultrasound guided FNAC where uh, with the ultrasound probe we look for the lesion, aim the needle into the lesion by seeing the live screen, and remove the tissue for further examinations. Um, or we can do ultrasound or MRI guided or stereotactic X-ray guided biopsies or FNACs. Then a pathologist examines all these samples and makes a final diagnosis. Depending on the facility, the radiologist or the referring physician will share the results with you. With early detection and improved treatments, more women are surviving breast cancer. If a cancer is diagnosed, your doctor will discuss your treatment options, and together you will determine the course of treatment. And there is a new screening technique which is used in India, uh, uh, got through artificial AI, artificial intelligence, that is called Nirmai screening. Um, that also doesn't have radiation. Um, In this procedure, also the breast is cooled and compressed, and images are obtained. The sensitivity is 91%, 91.02%, specificity is 82.39%, and net positive prediction value is 97.88. And it's an FDA approved imaging procedure which was recently introduced, and people still don't have access to it as much as mammography is available. Maybe slowly it will be introduced. So this is how we will proceed with the breast cancer screening. Any questions you can ask me? Thank you, everyone. So any questions you can always get back to us, and we'll be here to help you. Thank you. Okay, somebody has asked PET scan is necessary if the lesion is detected. Again, it depends on which stage the lesion is detected. Uh, if it is just confined to the breast and no other lymph nodes are seen around it, it might not be required. But if it is more than stage one, depending on your condition, your oncologist will suggest before planning a surgery as how to go about with the type of surgery and the type of treatment to be given. If it's only a single lesion in one of the breasts, PET scan will be done at a later stage. Okay, thank you, everybody.